All right, so this next tape job quickly is just the kind of classic shin splints compression wrap tape job on the lower leg. Shin splints is usually, might be defined like an area where, pain in the lower leg, and it'll be on that medial border of the tibia, so it's an easily defined area to palpate. And so basically what we do is just use a compression wrap to kind of alleviate some of the symptoms. Doesn't cure the problem. So the problem's going to be cured with the proper identification of what's causing the problem, and then the proper treatment and rehab. Okay, we can get into that stuff a little bit later with another video. So what we're going to do is we'll just identify with a little bit of like a marker here that, let's say this is the area that the athlete is complaining of pain. All right, so what we want to do then is make sure we do a compression wrap that goes distal and proximal to that area. And you've learned in class about when we do closing on our ankle tape jobs, and I kind of always teach everybody to put their tape on medial to lateral. Well, this is where we're going to do the opposite. So what we're going to do is we're going to start the tape laterally and come around. So lateral, come around posterior, and then bring it back up medial. Because what we're trying to do is just kind of pull that tissue back towards the medial border of the tibia. So all things considered, I mean, when we talk about skin preparation and taping, if it was a clean shaven leg, it would make it easier actually to have the tape adhere right to the skin, and you use some tough skin, spray it on there. So for this demonstration, I mean, I'm not going to spray it, but we'll pretend that we're doing it. So we kind of spray all over to make a nice sticky adherence. And also what I'm going to do too, since my athlete's got a hairy leg, we're going to use pre-wrap. I don't really recommend using the pre-wrap because it doesn't then stick that great and it'll slide. But for this demonstration, we're going to do that. So I just throw my pre-wrap on. So again, I'm distal. I'm just below that area where the athlete's having discomfort, and you can see I'm just going slightly bit above or proximal to that. And what I'm going to actually do here is I'll just kind of draw again that area, say, oh yeah, that's that area where he's having discomfort. All right, so basically I just use my closing strip principles and kind of start at I almost did it the wrong way. Start lateral, and I'm doing that at an angle here, and as I come back up, I can kind of give some pull to the tape, that compression. And then we just use the basic principles of overlapping. So overlap half the distance of your previous strip of tape. And then we're going then, keep on going. And I think you can see the pattern. If you can't, maybe we'll do this again with some colored tape, okay? But all we're doing is overlapping and doing, and it's good, like I said, you start at the tape here, and then you come and end the tape there, overlap it, and then also go past the beginning of the tape, so there's it's going to mend and actually have some good overlapping adherence. Okay, and then the last one, I'll just do that one right there. Okay, there you go. And so basically we just see that kind of overlapping strips, and if you notice that again, so here's like the edges of each previous strip of tape. Okay, so again, we're going to start lateral, and then it's going to come back around and come back to the medial side. Okay, mm-hmm. All right. Basically, we just want to compress the tissue up against the medial border of the tibia. All right, so that's your generic shin splints compression tape job. The last thing is you can always I start off with one layer on the athlete. If they feel they want a second layer, that's fine. There are definitely some tweaks to this too. I've actually used flexi wrap